Welcome to the Talking HealthTech podcast. My name is Peter Birch. Today on the show, I'm joined by Sylvia, Fazekas and Tracy Pemberton from Miller Blue. G'day team, how are we going?
Good.
It's great to have you here on the show, and I know we're going to be diving into a topic that I harp on a lot about on the show because the technology is cool, but the technology is there. But the real kind of challenge comes with the squishy individuals that participate in said technology transitions, and that's the humans, and that's the change management stuff, and that's what we're going to dive deep into today. But firstly, I might get to throw to you so we can learn a bit more about yourselves and your background. Sylvia, I might start with you. Tell us a bit about you and what you do.
Yeah, thanks, Peter. Well, my name's Sylvia, and I have a health informatics background. So I have a degree from Canada and how to be a clinician and a middleman between clinicians and IT, so that I have a way of speaking both languages and can understand how to translate back and forth. And I've worked in the Australian healthcare system for nearly 20 years, rolling out electronic medical records and medication management systems. So dealing with all the easy stuff when technology was brand new and we were using flip phones to try to figure out how to implement digital health in hospitals. And I've also worked on some interesting nationwide projects as well, implementing technology solutions in the digital health space. And I have a major focus and passion about user engagement and making sure that everyone feels like they know how to use the system and everyone feels that they are supported using the system so that we can implement them appropriately so they can actually do what they're meant to do, which is improve patient care and improve our experiences.
Amazing. Talking my language and focusing on the right thing. So great to have you on the show. I think flip phones are coming back though, by the way. So I don't know what's going on there, but that's a conversation for another show. Tracy, what about yourself?
Thanks, Pete. Tracy Pemberton. I am one of the co-founders of Miller Blue Group. My background is in the public sector and also in consulting. So I have worked for a number of government departments in the UK and also in Australia, but also as a consultant for some of the larger consulting firms and some small boutique ones as well. And over the last 15 years, almost exclusively in health in Australia. So the work that we do at Miller Blue Group in particular really focuses on digital transformation. We develop strategy. We do a lot of policy reform work, and we also do a lot of work related to workforce. And a lot of that is really grounded in healthcare and healthcare in Australia. So digital transformation for us is a really big focus area. We've been involved in some national systems implementations. Both Sylvia and myself have recently been implementing a national system for medical education. We've also been involved in implementing statewide rostering systems. We've implemented, as Sylvia said, lots of medication systems as well. So we've really been involved in a lot of that at-scale implementation work of digital health solutions. And through that, our focus has been much more so on the implementation side and the people side, and how do you actually get these systems working effectively? It's not just about the tech, it's other people on the other end of them using them effectively and getting the most benefit out of them.
Yeah, super cool. And look, I love that you're both bringing experiences and stories that, you're not going to be able to Google, or you're not going to be able to find through a large language model query or something like that. There's something unique in going through those transitions firsthand, particularly in public or private healthcare, to really make an impact. So, Sylvia, in this conversation, as we've alluded to, we've titled it "Enthusiasm as a Service," and I want to come to that titling in itself in a little bit, but also the art of change management in digital health. So, tell me more about why change management is so important in digital implementations, particularly in healthcare.
Well, the challenge with healthcare is that it's very complex and there's a lot of moving parts, and we hold people's lives in our hands, really, whether it's directly or indirectly. And our target audience in healthcare, an IT system, or even a new process, procedure, anything like that, is not front of mind for them. Their front of mind is, how many people have I got sitting in my ED right now that I need to deal with before the end of the day? How many patients do I need to discharge? How many beds do I need to clean before we can get the new admissions, because that's causing the bed block? So technology solutions are not front of mind. And when we try to implement technology solutions, we need to implement them in a way that is as seamless and with minimal interruptions as much as possible in their clinical day-to-day activity. We need to find a way to slot these into their busy days, knowing that we can only get clinicians out for a 2-hour training session once a week to learn how to use systems that IT companies tell us require 36 hours of on-the-job or classroom-based training to learn how to use appropriately. We don't have that ability. When it comes to change in healthcare, the first thing you need people who understand what healthcare is. And if the first question somebody is asking is, what's a JMO? We have a problem in healthcare. Because if you don't understand even that level of clinical context and how a hospital works, you're going to be fighting uphill. It's around understanding the fact that you need to meet clinicians and you need to meet the workforce in their environment to implement change. You need to speak their language. So you need to speak the language of an orthopedic surgeon, the language of a respiratory physician, the language of a nurse practitioner, the language of an allied health professional, the language of admin, and the language of the cleaners who go around. Because when you're implementing digital solutions, if you're introducing a workstation on wheels in your hospital, your cleaners are going to be involved in some way, shape, or form in having to navigate around what that new device is and how they need to be working with it. Enthusiasm comes from knowing your target audience, knowing the solution you're trying to implement, and really understanding the benefits to those users who will be impacted by it, and going around and selling those benefits to them in their language that they can understand, and having educated conversations with them around the challenges and barriers that they perceive, where the benefits are that may outweigh those particular barriers at that point in time, and recognizing and working with them to recognize what you are getting when a system goes live will be, for that system, the worst iteration of that system that you will ever see. And that's not to say that that system is bad, because hopefully it's of a really high quality and an excellent system when it goes live, but it will only ever be the worst version. And you haven't seen the versions prior to that we've had to deal with to fix up and make technical people realize that's not how a clinical environment works. When the system goes live and you're using it, you need to be in that environment, at the elbow, at the shoulder of people using it in a non-judgmental way, helping them to understand how that system works. Because the first time a system is implemented, it will take them 3, 4, 5, 6 times as long to do the task that's muscle memory for them in the new system. And you need to be there to reassure them, this is not your new normal. This time to do this activity right now, when you're trying to figure out which button to click and what this term means, is not your new normal. And if you build that muscle memory, and we are here to support you, and we will be there encouraging you along the way as you click that button, as you upload that report, and as you look at that screen, we will be there to support you to do your job well and effectively, so we can get you back to time neutral, if not saving more time, and then showing you all the flow-on benefits of that particular activity that you're doing. So it's important to understand what they do and why they're doing it, and to meet them at their language in their workspace to support them through that change. It's not a case of releasing something, sending out an email and say, good luck with it, have fun. But it's very much around getting excited by it and then getting others excited by it. And I used to tell my change teams and I used to tell my project teams, if you don't believe in a product and if you don't get excited by it, how in the world can anybody else? And that's the way that I approach change management. And that's what enthusiasm as a service is.
Love that. And actually, for those keeping score, JMO is a junior medical officer, right? I passed the test on that.
You passed the test. Good. You passed the test. You're in the right industry.
Great. Thank goodness. And for those keeping score at home, if you do need the glossary of health tech terms on the Talking HealthTech website, I'm sure JMO is in there, plus many other acronyms and exciting themes and concepts we talk about. But back to the conversation, and actually just building on that, Tracy, because the risk we run of doing an episode about the importance of change management in healthcare is I don't think you'll find too many people in healthcare who'll say, I disagree with you. I don't think change management is important. But I think building on what Sylvia is saying too, it's not just acknowledging, saying, well, let's make sure change management is, we do change management in inverted commas. There's a lot of, like, in my own experience too, often those breakdowns happen when kind of what Sylvia was saying too, where one side versus the other side feels like neither understands what the other one does, or they just don't get it. So, needing to do change management in healthcare, that need has existed for a long time. Why do we, or how do we think differently about it so that change management is actually more impactful in healthcare?
I think it's a real challenge, and it's not just it's not specific to healthcare, but I think when you're implementing digital transformation in a government-funded environment, where you are having to work within certain parameters, traditionally the way that digital transformation gets done is that a business case is written that'll define a goal and a start and an end point for implementing a system or implementing a change. And then the project is set up with a defined start and end date, and that defines how and when things happen. And that's really important, because in a government-funded environment, you've got to set those parameters, you've got to have a budget, you've got to make sure that you're working within those constraints. But the reality in a digitally enabled environment is that it is not static. And once you've got that initial system in place, you're not done. It's not a once and done effort. It is a continual effort of engagement and support, and particularly with software as a service, as Sylvia said, the version of a system that you're operating on now is the worst version of that system. It's going to change. It's going to get better, hopefully, as your vendors release new enhancements, as they listen to their user base, as they improve things over time. There'll be new things coming and new ways of working. And that change effort needs to extend beyond that project environment into a real BAU environment. And what we find typically when we're looking at budgets, and I've been involved in a lot of business case development, budget development processes, that piece around change management support is often one of the most vulnerable parts of your budget. It is often the piece that is redlined first, because it is intangible. It's not a nice new shiny box. It's about people, and it's about supporting that people. So I think it's about really embedding that within our operating model, is that it is not just about the support for the infrastructure and the hardware and the tangible assets. It's about that ongoing support for the people component. You will never fully realize the benefits of a digital transformation if the people on the other end of that transformation are not using that system to its full capability and capacity. We've seen lots of platforms that have really significant potential, lots of fancy functionality, but really only 10% of that is being leveraged. And that's because we're not developing the capability or understanding in the end users as to how to best leverage that. So I think it's a bit of a mind shift into that BAU model around change being part of everything that we do, not being part of that static project envelope.
Yeah, and I think about my own experiences as well. It's not like, if I was a manager or a people team leader or something who was implementing really knee deep in the change management process, and I know my team well, and this person's going to adopt it well, and this one's going to need some more support and all of that. A lot of that best intentions of, I'm going to invest the time and everything into the change management process, in inverted commas, but then executive or management or the person above me says, we need to do this faster, or that's not good enough, or some other reason that we need to cut corners. And exactly to your point, Tracy, the intangible big line item of this is the change management element. It's like, well, just do it better then, or do it more efficiently, or something that kind of suggests you can wave your hands and it'll just or even get better people. I've even heard in more kind of toxic environments. So it's a hard one to get that expectation all the way through the organization. So Sylvia, from your side, how do you navigate that need to get that buy-in right from the people using the new system that's kind of plonked into their laps, and they need to become advocates and love the thing, right up to board, I guess, if it's a big enough project, who are going to be looking at it on a quarterly or a monthly basis and will make decisions based on very high level spreadsheets sometimes?
What I've done in the past is I've actually taught those users how to use the systems as part of our change management strategy. So I've had my chief executives in hospitals sit down and learn how to use a prescribing system and to do a training session the way a JMO or a junior medical officer or a consultant would, administer a medication the way a nurse would. Because again, when it comes to change management, when a senior stakeholder in a hospital decides that they don't want to participate because they think it's too hard or it's not part of their job or any other excuse that they give, they're not going to come complain to me. They're going to go to the board or they're going to go to the chief executive. And what I need at that point in time is our senior leaders in the digital health space to be informed enough about the solution to have an informed discussion with them. And to tell them, if it takes you 5 minutes to prescribe a Panadol, you're doing something wrong, because I know how to do it and I know it doesn't take that long. And I think that is one of the very, very, very important elements of change management, where the board thinks they don't need to know, or they're too high level, or other members. You have people who are making decisions who aren't the actual users of the system. And as wonderful as this to have somebody who's all across the policy and the procedures and how things should be done, you also need the people who work on the floor who can tell you in reality, again, when it's a busy emergency department and there's ambulance ramping and somebody has vomited in the middle of the floor and all the other things are going on, why some of these things are challenges, and why you shouldn't have a mandatory field for every single thing that you think you need to collect data for, because that's only going to slow down your workforce from doing the job that they need to do. So that has been, when they see how complicated a system can be and how we try to work with our end users to simplify the solution and make it as easy as possible for them to do their jobs effectively, they tend to come on board fairly quickly with the system and understand why there is that need for change management and why there is the need for the people to go out there and be at the elbow with their clinicians at the time of go live. And again, I've had a discussion previously at a senior leadership meeting to say, you've now rolled out this solution 3 times and you're still recommending this particular approach. Is it because your team isn't good enough to roll it out faster? And I said, no, in fact, it's the exact opposite. My team are experts. We know these systems like the back of our hands. It is a brand new thing for every single one of your 3,000 staff members in your hospital. And we need to engage each of those 3,000 hospital staff members to make sure that they have a good experience with the system, even if it's not on how to click a button, to understand enough that the system can do what they need it to do their jobs effectively and not hinder them, so that they can engage and come on board effectively. And again, we can't do that via email because they're not going to read those emails and they're going to have the time to assimilate. But we need to have a way that we can approach your team members so that they feel supported, because when people feel supported, they will engage more effectively and they will be able to know how to use the system to do their jobs well, not spin their wheels.
Look, it's the least scalable solution, but often the most effective. And I even think of myself personally of when I'm utilizing what feels like a complicated piece of technology, to have a human who might know a little bit more about it next to you, the amount of reassurance that provides, or at least confidence in trusting the process, I guess is a common term as well, is really valuable. So, and I appreciate there's some very large implementations where that might seem like it's not possible, but the value is certainly there to explore. So that's a really important point. It brings me back, Tracy, to, the concept of enthusiasm as a service. And Sylvia did explain that in quite a bit of detail. Because originally, I guess some people might look at it and go, well, maybe we just need more cupcakes, or maybe we need more branded T-shirts with the logo of the new system that we're implementing and all of that. I'm being a little bit facetious when I say that. But what does it look like on a day-to-day to bring enthusiasm as a service, other than having that moment 5 minutes before you start in the bathroom telling yourself you can do this, Peter Birch? Bring the positive vibes and then suck it up, and then you cry under a blanket when you get back home. Is that tell me the better approach to it?
Well, we personally get very excited about the potential that these technologies have. And I think we have the benefit of being involved in some of those strategic conversations up front. So that scene setting, that business case development, we've really involved in understanding what the potential of these solutions is in the long run. But then you find that message sometimes gets lost when you get down onto the ground. And those people at on the ward, on the forefront, they are really only interested in their day-to-day. So they haven't had that benefit of the journey that we've been on. And Sylvia is absolutely the expert at this, but Sylvia really brings that embodiment of potential with her when she's talking to users of a system. Sylvia gets very excited about the benefits that a system can deliver. So when we implement systems, they can reduce administrative burden, they can create capacity, they can remove a lot of the heavy lifting of clinicians and allow them to do the things that clinicians are there to do, which is support and care for their patients. But sometimes that gets lost in the noise of, I've got to learn something and I've got that upward learning curve before I can actually see that benefit being delivered. And what Sylvia does is really focus in on these things and really give them that confidence that even though there is a bit of a pain, there is a gain to be had at the end of that. So really focusing on the benefits, what's in it for you. I can see that if you really invest in this, you're going to have a better time and things are going to get better afterwards. And there's some really cool and exciting things that can happen if you really invest your time in this.
Yeah, I mean, you absolutely would get more buy-in if, for an individual, they are who may be a clinician using the system, if it means eventually it's going to cut out this particular step or this really clunky system we used to do. We don't need to do that anymore. And maybe even, I guess that's why we sometimes talk about quick wins and stuff like that, Sylvia. Am I kind of on the right track there?
Yeah, absolutely. Absolutely. And even just visibility and transparency in the system, I think, is such a big thing that all of these digital health solutions provide. Oh my goodness, you don't need to go up to a ward to find your clinical records. What a win is that. You don't need to chase forms that may exist in different hospitals and find a way to scan and fax or other ways to get that information back to you that you then can't read anyway. The amount of potential with these systems, but the big thing is they have to be implemented the right way. People have to know how more than just that 10% that they're clicking on works. And I liken some of our systems to an octopus on a spider web. There are so many moving parts that interlink, and doing something on one side can have so many downstream impacts that can be very positive, but you need to understand why these bits work the way that they do. And the other element of change management, and this is why even in the nationwide role that I'm working with right now, working with so many facilities, I take the time to have the one-on-one calls and I take the time to see what people are doing, because it's not enough to ask somebody, are you doing okay with the system? Is it working for you? Because they'll say yes. We drive our cars. Can I drive? Yes. Do you know what all your buttons do? No. Will some of them do things that are good for you if you knew what they did? Absolutely. So I actually stand back and I watch. So even when I was doing in-hospital change management, I would stand back and watch. And doing Teams support, I stand back and watch. Show me what you're doing, because that's where we can identify where they are missing steps, doing additional tasks, or doing the wrong things that will hinder them going forward. So you watch and say, oh, if you want to do this, in fact, there's this other way of doing it. Tell all your friends, because it will save you time. So I think that's very important. Asking people, are you okay? And walking away is not the way to manage things. It's really making sure that we can see what they're doing, because as Tracy said, and as we've alluded to, we're the experts. We live and breathe these things. It is such a small part of anybody else's day. We are best placed to understand how all the bits work together and to show them in their context which of those bits are relevant to them at that point in time.
And there, depending on the project too, there's remarkable value that can come from seeing it being used in the real world, in inverted commas. And you could have done all the testing that you need, but to see and then to be able to feed that back up through the project team as general improvements overall, and surely that improves buy-in to see if a clinician or a user, an administrator, whoever sees a change that's happened in a system due to feedback they provided, then you really that can fire you up. I think that's a really important factor as well. And Tracy, the thinking about then as we start to wind out the conversation, just generally for organizations that you do work with through Miller Blue Group, how do you even approach, like, because it's not like, I guess it can sometimes, I imagine it could be quite cut and dry. It's like, okay, we're going to be implementing a system. Let's call up Tracy and say, let's make sure it goes well. I'm going to hazard a guess that your involvement with health systems is at varying stages of a process. Sometimes it's not as cut and dry. This is when it starts, and this is when you finish. And as you already suggested, it's kind of not a once and done thing. How do you go about supporting organizations through change? At what stage should they be getting in touch?
Well, I think it needs to be thought about at all stages of the process. So it is definitely a requirement at that business case, that planning stage, absolutely, in terms of action when you're doing the implementation. And then I've talked about that ongoing need. So it is at all stages. But that's quite I guess that's quite a nice view of the world, and that's not always what happens in practice. So at any point in an implementation, I think when you are starting to think about the people impacts, I think you should really think quite strategically about that change management process, and not just to pay lip service to it. I think it's very easy to create a change plan. I think it's very easy to create some artifacts, but really put yourself in the shoes of the people that are going to be experiencing this, and perhaps bring some of those into the conversation as well to help you plan some of those activities. A lot of that can be led by the centre or from the centre. And as Sylvia says, she spends a lot of her days working with people in hospitals and really providing that support. But we see a lot of value in peer support as well. So bringing together users of a system, they can talk together, particularly in a project that we're working on at the moment. We've found some fantastic users that are very enthusiastic about the system and the potential, and them sharing their stories and them engaging with others that might be feeling a little bit more challenged is so much more powerful than us trying to drive that from the centre. So leveraging that whole community aspect as well has been really important.
And Sylvia, lastly, I'd actually be keen to kind of put myself in the shoes of a JMO or a medical administrator or someone who might be listening to this episode and think, well, I've either been in that situation before where a system was implemented and I think a particular way about it, or no doubt if they're working in healthcare, they're going to be going through that process again. What advice or recommendations or hot tips would you provide to the frontline that's going through an implementation to be able to keep their sanity, I guess, but also to be, because that's the thing. It's not like, well, how, we want you to be part of the system or part of the process. Like, they need to see value in it too. What any advice for those that are actually going through a change management process?
I think the biggest piece of advice is engage. Engage. We know you're busy. We know you have clinical workload. We know you have administrative workload, but we need you also to come to the party, and ideally with an open mind where you're there to want to learn and to work with us, because we will give you everything that you need plus more. But if you don't come in the first place, we can't share that with you. If you come and your goal is to find flaw, again, the time that we could be spending to get you to a level where you can use the system effectively is reduced by us having to work through the arguments with you. And we know the answers to those arguments. We've had those discussions. We know the answers to the arguments. But we still have to work through that with you. And that's fine as well. We're happy to have that educated discussion with somebody that's willing to have an educated discussion. But really, come to us, come with an open mind, use the system, see what it does, ask questions when it does things that seem funny, because we will either give you the logic for why it does that, or you have found something that, as you said, hours and hours of testing in a clinical environment, as in clinical being following test scripts, does not reflect how it's used in the real world. Again, where you've accidentally clicked something because somebody's vomited next to you and you've ended up being pushed onto your keyboard, or you're using backspace or other things. Come to us, tell us what it's not doing right, tell us what you need it to be able to do, and we will be able to either help you figure out how to get that done, or we will put in requests to get that worst version enhanced. But the big thing is, come to us. Be available. We know it's hard, but give us a few hours of your time and you can get back hours in productivity.
Love it. Great message to finish on, and I appreciate you sharing that because it comes with a wealth of experience. So it's been great to chat. Sylvia, Tracy, thanks so much for making the time. We'll put the details in the show notes of this episode, and people can check out the Miller Blue Group listing on the Talking HealthTech website as proud THT Plus partners. But until next time, Tracy, Sylvia, thanks so much for your time.
Thanks, Pete.
We hope you enjoyed this episode of Talking Health Tech. Make sure you like and subscribe and share this episode with someone who might find it valuable. For more information and resources about healthcare innovation, visit talkinghealthtech.com.